Do not take medication for ADHD until you do this. Stay tuned. Hello everyone, welcome to my channel. I am Dr. Courtney Dookie, a registered psychologist. Today I want us to grapple with a few questions that's been on my mind. And that as it relates to attention deficit hyperactivity disorder. We know in recent times the diagnosis of ADHD has been liberally been given to individuals. Sometimes these individuals have not been properly assessed for ADHD, but yet still they've been diagnosed with ADHD, and some individuals are even taking medications for ADHD even though they have not been thoroughly assessed. You may ask, why is it important to be thoroughly assessed? Well, based on the nature of ADHD and the fact that ADHD can overlap with numerous other disorders and challenges, it is important for us to have a proper assessment before the diagnosis of ADHD is assigned to any individual. Let's start with this question. What is ADHD? If we use the Diagnostical Statistical Manual of Mental Disorder, DSM-5, it defines ADHD as that it is a neurodevelopmental disorder characterized by persistent patterns of inattention, hyperactivity, and impulsivity that interferes with functioning or development. It affects both children and adults and can lead to significant challenges for kids in an academic environment or for individuals who in the work environment or in social settings. So in other words, ADHD can impact our lives in any given setting, academic, occupational, or social. From this definition, we can see that there are three components of ADHD: inattention, hyperactivity, and impulsivity. But also, according to the definition, it is a neurodevelopmental. So it has to do with how the brain develops. So as we look at that definition, and as we go through other videos, we're going to get deeper into different components of ADHD. But today, as we look at the definition, the components, and the risk factors for ADHD, in terms of how we use the definition and risk factors to ensure that we properly assess individuals before assigning a diagnosis to them. So let's think about it. What are some risk factors for ADHD? One risk factor is genetics. We know without a shadow of a doubt that genetics plays a very vital role in the diagnosis of ADHD. Actually, twin studies that I've done suggest that individuals who are identical twin have a higher rate of being diagnosed with ADHD than those who are, say, fraternal twin. So from twin studies, they've established that ADHD is between 60 to 90% hereditary, a genetic component. Not only that, but there are family studies who suggest that ADHD is highly hereditary. Some family studies go as far as to say up to 70% of individuals within their family lineage, especially close relatives. What I mean by close relatives, mother, father. If the mother or the father were diagnosed with ADHD, there is a 4 to 5 times more likelihood that the children will be diagnosed with ADHD. That's significant. So if we're thinking about diagnosing someone with ADHD, it would be important for us to do a thorough history with them, to understand their historical background, to understand their parental background, understand the history of their parents, understand the history of ADHD within the family. So any assessment that is being done must thoroughly explore the background of the individual who is being assessed. Because we're seeing from research that genetical makeup plays a key role in the transmission or the movement of ADHD or the development of ADHD within an individual. Right? So genetic plays a role. The second area that we can pay keen attention to when it comes to ADHD is how the brain develops, neurodevelopmental. So there is something about how the brain develops. I want to move this in terms of the way the brain develops into an aspect of ADHD that sometimes is overlooked. And that is the fact that ADHD, if someone should ask me to define ADHD within my own word, I would say ADHD is an executive function disorder. It's a challenge with executive function. What do I mean by executive function? Executive function has to do with how my brain processes information. So what are some areas of executive function that might be impacted by ADHD? One, working memory. The way how we recall things, how we consolidate memory, how we function with memory within the immediate, how we receive that memory, how we process that memory in that moment, in those immediate moments of listening or working through something, how do we function when it comes to working memory? And working memory is one aspect of executive function that is key in terms of assessing ADHD. Inhibitory control is another executive function that we need to pay keen attention to. What do I mean by inhibitory control? Another way to think of inhibitory control is self-regulation. How much, or to what degree am I able to regulate myself on a daily basis, to regulate myself in different environments, to regulate myself either at work, at home, for adults, or for children at school, at church, or at home? How do I regulate myself in different environments? A third component of executive function is cognitive flexibility. And cognitive flexibility is key because oftentimes people with ADHD or people who struggle with ADHD will say, if I get focused on something, I find it difficult to shift out of that thing. And that suggests a lack of cognitive flexibility. And that can manifest in different ways in life. Also, another aspect of ADHD, of executive function is planning and organization. And the final area is emotional regulation. So I want you to think about it. If, based on the evidence, that ADHD impacts negatively on executive function. And executive function has to do with working memory, inhibitory control, cognitive flexibility, planning and organization, and emotional regulation. Would it be important that if we're going to diagnose ADHD, that we must assess and test for these things? If I don't test for working memory, if I don't test for self-regulation, cognitive flexibility, planning and organization, emotional regulation, if I don't test for these things, I cannot say a person is diagnosed with ADHD. And notice I'm using the word test and not just screen. I'll get back to that in a few moments here. So one, we see that for ADHD, it has 60 to 70%, even up to 90% hereditary. We see that ADHD is an executive function disorder impacting different areas of executive function and areas that we need to pay keen attention to. Another area that needs to be properly assessed when it comes to ADHD is how environmental factors contribute to an individual and their functioning in daily lives. What do I mean by environmental factors? Environmental factors has to do with prenatal exposure to toxin, such as nicotine and alcohol. It's important in doing a history of the individual that we learn of any prenatal exposure to toxin. Also, we need to learn, was there any low birth weight? These are important factors that we need to take into account before assigning the diagnosis of ADHD. And one very important thing that needs to be properly documented and assessed before the diagnosis of ADHD is assigned is psychosocial factors and early childhood development. You think of it like this: the brain is a social brain. We have literature upon literature that tells us the brain is a social structure. Therefore, the way how we interact with the environment can lead to significant impact on the brain. So if you think about a child who's been exposed to traumatic events, we're going to think that that trauma can significantly impact the way how the brain functions. The environment, was it caring? Was it loving? Was it a compassionate environment? What was the parental relationship like with that child growing up? These are all questions we need to dig into and explore to understand the individual before a diagnosis of ADHD is assigned to that individual. So let's do some reflection. We have seen what ADHD is. We have seen the different areas, including genetic components. We're seeing that there is environmental factors. We're seeing that ADHD, in terms of this neurodevelopmental impact, has to do with more executive function. And we've also looked at areas where the environment, in terms of prenatal exposure, may contribute to the symptoms of ADHD. So the question we need to grapple with: if all these factors are there, shouldn't we spend time to explore these areas before assigning ADHD to an individual? Think about it like this. If all what I've said so far is true, that ADHD has a genetic component, ADHD is neurodevelopmental that impact executive function, that ADHD has an environmental factor, environmental factors that relates to prenatal exposure and other psychosocial factors such as childhood development. Can I assess these areas by using a 15 minutes screener? Think about the question. Can I assess an individual? Let me even lengthen that some more. Can I effectively assess these areas with a 15 to 60 minutes questionnaire? And use that 15 to 60 minutes questionnaire to diagnose an individual? The answer to that is no. In order to diagnose an individual with ADHD, a child or an adult with ADHD, there needs to be a proper assessment. What do I mean by a proper assessment? All the components that were mentioned before in terms of executive function needs to be tested. Notice I didn't say screen, I say tested. We need to administer tests to test for working memory. We need to administer tests that will test for emotional regulation, cognitive flexibility. We need to test for these areas. In other words, we need to administer a test that looks specifically at executive function, because fundamentally, ADHD is a executive function disorder. We also need to do thorough historical data collection of the development of this individual, all aspects of development, psychiatric development and physical development. And with that thorough background of this individual, and with the results of tests for executive function, we can use that information with the clinical interview that a good registered psychologist who's trained in this area will do. With all of that information, we can now look and determine if an individual fit the diagnostic criteria for ADHD. So, where am I really going with this? You may be struggling with symptoms. You may be struggling with certain things and behaviors and ways of functioning that you start to question, do I have ADHD? Do I have ADHD? If you're struggling with those things, I strongly recommend that you find a trained professional who is going to do a thorough assessment so that the result you get will not just be based on a screener, but the result will be based on appropriate assessment. So your diagnosis can be more, you can be more confident with your diagnosis. So hope that this video helped you somewhat to sort of think about it. If you're struggling with these symptoms, and if you need help, how to get help, and what kind of help you need to look for. Please, let's take a step back, do things the right way, so we can get the right treatment and get you in the right direction. I want to thank you so much for tuning in. And as we go forward, I will break down all the areas of executive function. We'll talk about the different brain areas that are vital for ADHD, and how these different areas that we talked about in terms of executive function, which part of the brain that they impact the most. And also we'll talk about strategies and how to manage the symptoms of ADHD. But until then, be strong, be courageous, and look in the right direction to get the right assessment so you can get the right treatment. Thank you so much. Take care, and bye-bye for now.